I want to start today with a statistic that I actually had to read 3 times because I was convinced it was a typo.
Oh, yeah.
It's coming out of India, but honestly, you could apply this to a lot of places. Here it is. 90% of the population suffers from some form of oral health issue.
90, it sounds unbelievable, right? Like nearly everyone walking down the street.
Exactly. But here's the number that really throws a wrench in the gears. Despite 90% having an issue, only 9% of the population visits a dentist in a given year.
Wow.
That is a massive, massive gap between I have a problem and I'm getting help.
It's a staggering gap. You're talking about hundreds of millions of people who are essentially, flying blind when it comes to their health.
So why? What's the barrier?
Well, when you dig into the why, it's not just laziness. It's the classic stuff. Fear of the drill, the incredibly high cost of treatment, and in rural areas, pure access. There physically aren't enough doctors.
Right. And usually when we talk about solving that, we talk about building more clinics or, training more doctors. But today we are doing a deep dive into a company that looked at that gap and said, what if we just use the thing everyone already has in their pocket?
The smartphone.
The smartphone.
Yeah.
The company is called Logy.AI. They are a startup out of Hyderabad, India, and their pitch is pretty wild.
It really is.
They claim they can turn your phone into a dental diagnostic tool.
Yeah.
And we aren't talking about some high-tech attachment you have to buy on Amazon. They say they can do it through WhatsApp.
Which creates a fascinating premise, doesn't it? It's not about high-tech hardware. It's about creating this digital screening front door. They are trying to figure out how to bring the clinic to the patient when the patient can't or, won't go to the clinic.
But I have to be the skeptic right out of the gate here. A dentist on WhatsApp? It sounds a little bit like a scam you'd find in your spam folder. Send us a selfie, we'll fix your teeth. How legitimate is this operation?
It's a healthy skepticism, but this isn't a couple of guys guessing. This is about using heavy-duty artificial intelligence to democratize healthcare for, the next billion users.
Okay.
We are talking about low-income populations in India, in Africa, places where a dental checkup is a true luxury.
So before we get into the tech, because I have a lot of questions about how a chatbot spots a cavity, let's unpack where this actually came from, because I know the origin story here is a bit more personal than your standard Silicon Valley pitch deck.
It is, yeah. Very personal. The company was founded back in 2019 by Prayanjit Ghosh, and interestingly, they didn't start with teeth.
Oh, really?
No, their original focus was pathology analyzing lab slides for diseases.
Okay, so they were already in the medical AI space.
Right, but then Ghosh hit a personal crisis that changed everything. His mother was diagnosed with oral cancer.
Oh, wow.
And as is often the case with oral cancer, it was diagnosed late. That experience, watching a family member go through that, created this intense emotional drive in him to solve for early detection. He realized that the difference between life and death, or even just a filling versus a root canal, is almost entirely about when you catch it.
It's that preventative mindset. Instead of treating the disaster, stop it from happening.
Exactly. So they pivoted to oral health. But then, almost immediately, the universe threw another curveball. 2020 happened.
The pandemic.
The ultimate catalyst. Suddenly, every dental clinic in the world shut down. Think about it. Dentists work inside people's mouths. It was the most high-risk environment imaginable for a respiratory virus.
I remember that. You basically couldn't get a cleaning for a year.
Routine checkups just plummeted to zero. So Logy.AI launched a tool called MyDentist.ai in mid-2020.
Okay.
It was a teledentistry platform. The idea was simple. Let people take photos of their mouths at home, send them in, and use AI to do a first-level screening.
So it was a necessity is the mother of invention moment.
Completely. And it proved that remote screening was actually possible. But let's go back to your skepticism, because it's valid. You're standing in your bathroom holding your phone. How does a WhatsApp bot actually tell you what's going on in your mouth?
Right. I mean, my bathroom lighting is terrible. My hand shakes. Surely the quality is garbage.
That's the magic trick. The innovation isn't the camera, it's the accessibility. Logy.AI realized that in emerging markets, data is expensive. Phone storage is limited. People simply will not download a 50-megabyte medical app.
That they use once a year. It's not going to happen.
Not a chance. But everyone has WhatsApp.
It's ubiquitous, yeah.
Exactly. So you start a chat with the bot. It guides you to take 3 specific photos. One of the upper jaw, one of the lower jaw, and one front view of your teeth clenching.
Just 3.
Just 3. You send them in the chat. The images get sent to the cloud. They use AWS, and that is where the brain of the operation takes over.
Okay, let's dig into this brain. Because AI is a buzzword we throw around constantly. What is the computer actually doing? Is it just looking for black spots?
It's a little more sophisticated than that. It uses what are called convolutional neural networks, or CNNs. Now, without getting too technical, you can think of the AI like a detective looking for shadows.
Okay, I'm with you.
A human dentist uses a metal probe to feel for soft spots. That's tactile. The AI can't feel, so it has to look for specific patterns of discoloration, shadow gradients, and textures in a 2D image that correlate with depth or decay.
So it's pattern matching.
At a pixel level that the human eye might actually miss in a quick glance, it's analyzing the geography of the tooth based on light and shadow.
And they train this on what kind of images?
That's the key. They trained these models on a proprietary data set of over 10,000 images, and they had to build this data set from scratch.
Why? I mean, aren't there millions of dental x-rays out there?
There are, but an X-ray doesn't look like a blurry smartphone selfie. If you train an AI on perfect clinical X-rays and then show it a photo of my mouth taken in a dim bathroom,
They have no idea what it's looking at.
none. They had to train it on real-world imperfect photos.
That's a really important distinction. It's learning from the messiness of reality.
Yeah.
But let's talk results. Because if I'm sending a photo, I want to know if the advice is any good. Did they test this against actual human dentists?
They did. And this is the aha moment. They ran a study with Savitha Dental College where they compared the AI's conclusions against human dentists examining the same patients. For dental stains, 97% accuracy.
Okay, that's high, but stains are pretty easy to see.
Yeah.
What about the scary stuff?
For cavities, what they call caries, it was 85% accurate. And for calculus or tartar buildup, it was 83%.
Okay, pause. 85% accuracy on a selfie. I have to play the cynic here. My handshakes, the angle might be weird. How on earth is a WhatsApp bot distinguishing between a cavity and, say, a piece of spinach I had for lunch?
You are right to question it.
That number feels dangerously high for a non-clinical setting.
And to be clear, 85% isn't 100%. A dentist with an X-ray and a probe will always be more accurate. But think about the alternative. The alternative for these users isn't a 99% accurate dentist visit.
The alternative is zero care.
Exactly. It's 85% versus 0%. It's a screening tool, not a diagnostic verdict. It's designed to say, hey, there's an 85% chance this is a cavity. You need to go see a professional versus you're fine.
It's a triage system.
Correct. And it generates that report, including a risk assessment for sensitivity and bleeding gums in under 2 minutes.
2 minutes. Think about the last time you tried to book a dentist appointment. You're on hold for 10 minutes. The next slot is in 3 weeks. Logy.AI is trying to do for dentistry what Uber did for hailing a cab, just compressing that friction down to zero.
That is a great analogy. But there's another piece of the puzzle here that we need to talk about.
The business model.
The business model. Because you and I both know if an app is free, usually you are the product.
Always. If I'm not paying for this screening, who is keeping the lights on at Logy.AI? They aren't a charity.
No, they are very much a for-profit business. They use a B2B2C model, business to consumer.
Okay, break that down.
Basically, they don't sell to you, the patient. They sell the platform to organizations who want to reach you.
Give me an example. Who benefits from me scanning my teeth for free?
Well, let's look at the dental clinics themselves. Apollo White Dental, a huge chain in India, used Logy.AI in over 100 clinics. For them, it is a lead generation tool.
Ah, okay. So the AI finds the cavity and then says, click here to book an appointment at Apollo.
Exactly. It funnels paying customers into the chairs, but the really massive scale and where this gets clever comes from corporates, specifically Colgate Palmolive.
The toothpaste guy.
The toothpaste guys, they partnered with Logy.AI for their oral health movement. Colgate pays to put QR codes on millions of toothpaste packs. You scan the pack, you get a free screening.
Wait, so I buy the toothpaste, scan the box, and get a checkup.
Right. And for Colgate, this is gold. They drive their brand mission, sure, but they also collect massive amounts of data on oral health trends. And of course, if the app tells you that you have plaque buildup,
You buy more toothpaste.
you would buy more toothpaste.
It's a virtuous cycle. But does selling toothpaste actually solve the founder's original problem? I mean, does it actually help detect the cancer his mother had, or is it just moving product?
That's the tension, isn't it? But looking at the numbers, it seems to be driving real impact. Logy.AI's revenue was around $110,000 in FY 2023, which is modest but solid for an early stage, but they projected massive growth, 173% for FY 2024.
Wow.
But the real impact metric is the screenings.
Right. Let's talk about the scaling, because you mentioned earlier they aren't just in India. They went to Africa, too.
Yes, and this is where the logistics get fascinating. Logy.AI partnered with the Kenyan government and Colgate. Now, Kenya has a huge population and very limited dental infrastructure in rural areas. You cannot physically check everyone with
It's
doctors.
going to take decades.
So they used the force multiplier of the AI. In just 3 months, they screened 100,000 people.
100,000 people in 3 months.
Yeah.
Did they go door to door?
It was a mix of community health workers and digital campaigns. But think about the efficiency. If a dentist spends 15 minutes per patient, one dentist can maybe see 30 people a day if they don't eat or sleep.
Right.
The AI can process thousands of images simultaneously.
So the AI acts as the first line of defense.
It filters the noise, it tells the people with minor issues, go brush better, and it flags the serious cases for the limited number of doctors available. It makes the invisible visible.
It connects the dots.
Oh,
Well, I have to play devil's advocate again. If I'm a dentist in Kenya or India, am I looking at this and cheering, or am I thinking, is this robot trying to take my job?
that is the elephant in the room. And it's one of the biggest challenges Logy.AI faces trust. Initially, there was a lot of fear. Can a phone really see what I see? Is this going to steal my patients?
I'd be worried about the quality of the diagnosis.
Yeah.
If the AI misses something, who gets blamed?
Exactly. And that leads to the black box problem.
The-
Well, imagine a calculator that tells you the answer is 42, but refuses to show you the math. A dentist is trained to look for evidence. If the AI says cavity detected, the dentist wants to know why.
They need to see the proof.
They need the AI to draw a red box around the specific pixel area and say, I see a microfracture here.
Right. They need explainability.
Without that, it's just a prediction, not a diagnosis.
Yeah.
So Logy.AI has to work hard to position this as a screener and a lead generator, not a doctor replacement. They are telling dentists, we aren't the doctor, we are the marketing team bringing you patients.
It's a smart pivot. But let's go back to the tech limitation we touched on, the photos. We mentioned garbage in, garbage out. If I take a blurry photo in the dark, does the AI just guess?
It shouldn't. A robust AI needs to be able to say, I can't read this, take it again. But it is a huge hurdle. Blurry cams, shaky hands, bad lighting. And then there is the connectivity issue.
Right, because this all happens on the cloud. You need internet.
You need to send that photo to AWS. In very remote rural areas, that is still a massive hurdle. Logy.AI is planning an offline version, but think about the computing power needed. Running a complex neural network on a cheap $50 smartphone without the cloud, that is a heavy technical lift.
And what about privacy? I mean, I'm sending medical photos over WhatsApp. That feels risky. I wouldn't send my credit card number over WhatsApp.
It is a valid concern. Logy.AI has achieved ISO 27001 certification, which is the gold standard for information security. They take it seriously, but you are still relying on a third-party messaging platform. However, you have to weigh it against the reality of the user.
What do you mean?
For many of these users, the choice isn't secure privacy versus insecure privacy. The choice is AI screening versus no healthcare at all. If you have a rotting tooth and no doctor for 100 miles, you probably care less about encryption and more about stopping the pain.
That is a sobering way to put it. It's a trade-off.
There is also the issue of bias. They have to ensure the AI works on all types of mouths.
Right. Kids' teeth look different than adults.
Exactly. Or stained teeth from smoking, or betel nut chewing, which is common in parts of Asia. If the AI is only trained on pristine, white, textbook teeth, it will fail in the real world. It needs diversity in the data.
So looking forward, they've got the toothpaste deal, they've got the government pilots. Where does this go? Are we going to see this AI doing more than just finding cavities?
That is the roadmap. By 2025 or 2026, they want to integrate generative AI like the large language models we see everywhere now.
To do what? Have a chat with my tooth.
Sort of. Imagine the chatbot becoming a health coach. Instead of just a static report saying, you have gum disease, you can ask it questions. Why are my gums bleeding? How do I floss correctly?
Oh, that's interesting. So it becomes a personalized medical assistant.
Exactly. It raises the health literacy of the user.
Yeah.
And they are circling back to the founder's original mission, oral cancer.
The thing that started it all.
They are working on detecting precancerous lesions, like leukoplakia, via smartphone. Now, this is much harder than spotting a cavity. But if they can crack that, they could save thousands of lives in high-risk regions where tobacco use is common.
That would be incredible. 'Cause
Yeah.
by the time you feel oral cancer, it's often too late.
Precisely. And they aren't even stopping at teeth. They view themselves as a diagnostic front door for the whole body. They've already deployed an eye screening module for cataracts with the Indian government.
So eventually, I could scan my eye, my mouth, maybe my skin, all from my couch.
That's the ambition. They are aiming for FDA certification in the US and CE certification in Europe. If they get those, it opens up the entire developed world.
So let's wrap this up. We started with a personal tragedy, a mother's cancer diagnosis. We moved through a pandemic pivot, and now we have a tool that has screened over 500,000 people across India and Africa.
It's a testament to the power of accessible technology. The key takeaway for me is that the smartphone is becoming a medical device. It is bridging that gap between no care and professional care.
It really changes the dynamic of healthcare. It takes the power out of the clinic and puts it in your hand.
It does. And it leaves us with a provocative thought. As these AI diagnostics get better, more accurate, faster, capable of running on a cheap phone, will the future of healthcare be less about us visiting a doctor and more about the doctor's knowledge visiting us?
That is a wild thought. If the AI becomes better than the human dentist at spotting the early signs, which the data suggests it might do, we reach a point where not using AI is considered malpractice.
It's very possible the standard of care is shifting right beneath our feet.
Well, that's all we have time for today on this deep dive into Logy.AI. It certainly made me think twice about skipping my next dental appointment.
Or at least taking a selfie before you go.
Exactly. Thanks for listening, everyone.
Stay curious.
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.